Welcome to everybody. Good morning. Like I said, I wanted to, when I first got asked to talk about a story that was very dear, I started thinking about, the many stories that are out there in our network. Our complex care clinic is now maybe about 15 months old now. And it's got a lot of stories, but I wanted to talk to you about one in particular. And I wanted to talk to you about how we are beginning to be more coordinated in a complex world. So I wanted to see if we could first, or maybe introduce the story of how we met our patient, Pete. And Pete couldn't make it today, and we asked if we could have permission to talk about his story. But Pete first met our team when we got a phone call from a dear friend, Martha Heverin, who's an angel. She called me and said, Dr. Ayala, we have a very sick patient that I think is going to need a lot of help. And so if you can see Pete, it's up there. He's a new friend of ours. And so when we first met Pete, we began to see a lot of his medical records and history about Pete. And he had been to the hospital, or he had been visiting the ER every 2 days for the last year. And what that means for Pete is that he had a very complex life. And what he first he introduced himself, he came along with his wife, and he said, Dr. Ayala, I'm new here. I don't have a primary care doctor. And I have this condition that they told me in the ER where I have what they call cirrhosis. But they said that my cirrhosis is bad. And they told me that I probably have a year to live. So we started looking into his care. And he started telling me a little bit more about his story. Well, he also tells me that his father had cirrhosis and died. Brother had cirrhosis and died. And he was really nervous that he now has this condition. And at that particular time, the wife was in the back, and she wasn't saying anything. She hadn't said anything. And finally, she speaks up and says, Dr. Ayala, we've been to many doctors. We've been to the ER, we've been to the hospital, what is going to be different this time? And that was a challenge to me, but it was also very important, and why it was so important to me was because he had just been told that he might not have that much longer to live. So just like how when I have those hurdles in life, I ask God for help, and I pray. And in that particular moment, I decided to ask Pete and his wife, can we pray together? And the reason that I wanted to do that was because I knew that Pete, at that particular moment, did not need medicine, did not need procedures. He needed, at that time, hope. And I only know that prayer brings hope. And prayer answers a lot of our problems. And God is with us. So when we started thinking about Pete and we looked back into his history, remember he had been going to the ER back and forth every 2 to 3 days. But he also gave us another key thing. He said, I was supposed to go to San Francisco to a doctor about 3-4 years ago, and I was supposed to get a procedure done, and I was supposed to get on a liver transplant list. I said, well, where did you go? He said, I don't remember. I asked the wife, I don't remember. Do you have any records? No. So then we were faced with another challenge. And the reason that I wanted to bring that up was because at that particular moment, it wasn't my care anymore. It was something that I needed to do with the team. And so the team with the complex care clinic consists of one medical assistant, one nurse, and another doctor, Dr. Swifer, who everybody knows, is also in this clinic. But at that particular moment, I asked Lisa and Keisha, Keisha, we need to find out how we can stop him from going to the ER. And number two, we need to get this history from where he's going to these doctors. And that was our only challenge. And they started asking me, where do we get it? What do we do? What do we do? I said, I don't know. We're going to have to figure it out. So what we did was, remember, he was going to the ER to get fluid taken out. He was getting paracentesis every 2 to 3 days. So we decided to call the hospital and say, can we schedule him to get these paracentesis? We already know when he goes, and et cetera. So that was taken care of. He was now going, he wasn't going to the ER, he wasn't being hospitalized. He was getting these procedures done as an outpatient, which was great for him because it actually changed his life. Because 2 to 3 days out of the week, if you can imagine, he was spending in the ER in the hospital. So he only had really 2 days or 3 days to live at home because he would spend the whole day in the ER and he would get paracentesis. Then luckily, we were able to find records on paper charts. We went to the back of the paper charts back in those days, and we found the name of that clinic in San Francisco. And Keisha and Lisa called me and said, we found it. So she said, get me the name, I need to talk to the doctor. So I called the doctor, and she said, Pete, oh my gosh, we've been looking for him. You found Pete. I said, he's right here. What do we do? You got to send him over here. So we got to get him transport. We got to get him transportation to San Francisco. We got to get him this. We had to do all these labs, ultrasounds, et cetera, and just coordinating care with everybody. And everything stopped just for Pete because that's what needed to happen at that particular time. And Pete was so happy. We called him, Pete, we found that doctor in San Francisco. You're going to go and you're going to get your procedure. What are you talking about? So yeah, you've got a week. They're going to meet you next week. And at that particular moment, I knew that the care for some of these patients do not take one person. They take a whole array of people, managers, nurses, medical assistants, radiology. For Pete, there were so many people that touched him because that's what needed to be accomplished. And we all did it together. We all did it for one purpose, and that was to show Pete that who we were, and remember, the most important thing is we wanted to give him hope. And for Pete, that meant a lot because 2 months, 3 months before, he thought he was going to pass away just like his family did. And I wish he would be here because he did write something, and he says, thank you, Dr. Ayala, Keisha, and Lisa. Thank you to the Complex Care Clinic because you guys showed me never to lose hope, and I will keep having hope because of people like you that show God's love. That, in a nutshell, is Pete's story, our story. But remember, I know that it wasn't just me. It was God who guides the light and guides our steps. But it's people like the team. And I wanted you to introduce the heart of Complex Care Clinic and these stories. Dr. Swifer, who is also there, Lisa Chavron, and Keisha. So they are the heart. And without them, Pete's stories would not be those stories. Thank you very much.